Some injections don't require guidance, typically occipitalis and the suboccipital muscles immediately below the nuchal line. They don't require guidance to be injected. There's nothing else to hit there. And the protocol is to give 3 to 4 international units in multiple sites. And I'm just going to do that now, scratch. So 15 units, 5 sites, means 3 units per site. And this is working on the theory that we are treating the afferent pain inputs, not necessarily the muscle spasm with this. On the other hand, this next injection I'm going to do for levator scap, which is a muscle that runs from the posterior transverse processes and interspinous ligaments of the middle and lower cervical spine to the medial border, superior medial border of the scapula, and helps elevate the scapula and also helps move the neck around. And in some patients it's overactive, and we'll easily be able to see this here on this patient. In these patients, often you can palpate the increased muscle tone, skin, subcutaneous tissue, trapezius, levator scap. That bulge there is a facet joint in her cervical spine. Scratch now. I'm too superficial, so I go a little deeper, and now I'm in levator scap. So now I'm just going to do trapezius. Again, you don't need guidance for this. You can gently palpate trapezius, and it's a relatively superficial injection, and there's nothing dangerous in that posterior triangle of the neck. And multiple sites, again, big muscle. There's a total of 200 international units, with 70 units going into bilateral masseters and temporalis, and the remainder of the units distributed over the scalp, levator scap and trapezius muscles, and of course we injected the left-sided scalenes with 20 units, total of 200 units, and hopefully that'll give us a good result for Miss S.